For this project, we wanted to have a look at how pathological fractures were managed in the TNA department. So protocol usually follows that when a patient presents with a suspected pathological fracture, by that I mean fractures from bone metastases, they get sent off for an x-ray and then they go to theatre and reaming samples, which are samples taken from the bone, are sent off for histology. And this would usually confirm the diagnosis or confirm what cancer it is. We wanted to find out whether this was actually useful in clinical practice because often patients already have known metastases to the bone and they already show positive radiology, so evidence of metastases on x-ray. So then what's the point of doing the reaming samples if it doesn't change the investigation or the management? So we identified patients from a trauma database and we looked at why reaming samples were sent and what the samples showed. And all the patients who had positive histology all already had known metastases to the bone. And they also all had known radiographic evidence of metastases to the bone. So the reaming samples didn't change the management and didn't change the outcome. And while they're useful in other areas of clinical practice, we are of the opinion that if patients have such a history of cancer and history of metastases and they show evidence of metastases on radiograph, there is no point in doing the reaming samples as it doesn't change anything. And of those patients who had query malignancy, where they didn't know whether there was a malignancy and they had no history of bone metastases, if they don't show radiological evidence of any metastases, then it is likely that histology will be negative as well. So that is what we found at the end of this audit.